Integrating multiple modalities effectively. In the realm of therapeutic practices, the integration of multiple modalities stands as a transformative approach that aligns with the ethos of therapy as a partnership. This integrative methodology not only enhances the depth and efficacy of therapeutic interventions, but also mirrors the complex, multifaceted nature of human experiences and relationships. As we delve into the intricacies of integrating multiple modalities effectively, it becomes crucial to dissect both the theoretical frameworks that underpin this approach and the pragmatic strategies that facilitate its application in real-world settings. Pause. Integrated therapeutic approaches capitalize on the strengths of various therapeutic modalities, creating a synergy that transcends the limitations of singular methodologies. This synthesis is grounded in the recognition that each therapeutic modality offers unique perspectives and tools, which, when combined, can provide a more holistic and nuanced understanding of the client's needs and circumstances. For instance, cognitive behavioral therapy emphasizes the identification and restructuring of cognitive distortions, while psychodynamic therapy explores the unconscious processes and past experiences that shape current behaviors. By integrating these modalities, therapists can address both the surface-level cognitive patterns and the deeper underlying emotional conflicts, thereby fostering comprehensive healing. The theoretical foundation of integrative therapy is multifaceted, drawing from diverse schools of thought. One pivotal framework is the biopsychosocial model, which posits that biological, psychological, and social factors all play critical roles in human functioning. This model encourages therapists to consider a wide array of influences on their clients' mental health, thereby promoting the use of multiple modalities to address these varied dimensions. Furthermore, the integrative approach is supported by research on neuroplasticity, which illustrates the brain's capacity to change and adapt in response to different forms of therapeutic intervention. By integrating modalities, therapists can stimulate different neural pathways, enhancing the potential for cognitive and emotional transformation. Pause. From a practical standpoint, the successful integration of multiple modalities necessitates a strategic framework that is both flexible and client-centered. One effective strategy is the use of a modular approach, where therapists select and apply specific components from different modalities based on the client's presenting issues and therapeutic goals. For instance, a therapist might employ mindfulness techniques to enhance emotional regulation, while simultaneously using narrative therapy to help the client reframe their life story. This modular approach allows for customization and adaptability, ensuring that the therapeutic process is tailored to the unique context of each client. In the process of integrating modalities, therapists must also be adept at navigating the potential challenges and tensions that arise from combining different theoretical orientations. One such challenge is the risk of theoretical incompatibility, where the core principles of different modalities may conflict. To address this, therapists must engage in critical reflection and dialogue, exploring the underlying assumptions and potential synergies between modalities. This reflective practice can lead to the development of hybrid interventions that draw on the strengths of each modality while minimizing their respective limitations. An illustrative example of effective modality integration is the case of Maria, a 34-year-old woman experiencing symptoms of depression and anxiety. Her therapist employed an integrative approach that combined elements of CBT, mindfulness-based stress reduction, and eye movement desensitization and reprocessing. The CBT component helped Maria identify and challenge her negative thought patterns, while MBSR provided her with tools for managing anxiety through mindfulness practices. EMDR was used to process traumatic memories that were contributing to her depressive symptoms. Over the course of therapy, Maria reported significant improvements in her mood and a greater sense of emotional equilibrium, demonstrating the efficacy of a multimodal approach in addressing complex psychological issues. Another case study that highlights the power of integrative modalities involves John, a 45-year-old man dealing with chronic pain and associated emotional distress. Traditional medical interventions had provided limited relief, prompting his therapist to adopt an integrative strategy that blended acceptance and commitment therapy with somatic experiencing. The ACT component focused on helping John develop psychological flexibility and commit to values-driven action despite his pain. Somatic experiencing, on the other hand, addressed the physical dimension of his pain, using body awareness techniques to release tension and trauma stored in the body. Through this integrative approach, John experienced a reduction in pain intensity and an improvement in his overall quality of life, illustrating the potential of combining psychological and somatic modalities. In examining competing perspectives on modality integration, it is essential to consider the debate between purists and integrationists. Purists advocate for the exclusive use of a single therapeutic modality, arguing that depth of expertise in one approach yields the best outcomes. In contrast, integrationists contend that a multimodal approach offers greater flexibility and responsiveness to client needs. While purists raise valid concerns about the dilution of therapeutic efficacy, the growing body of research supporting integrative practices suggests that the benefits of a multimodal approach often outweigh the risks. Incorporating emerging frameworks, such as polyvagal theory, into integrative practices offers novel insights and applications. Polyvagal theory, developed by Stephen Porges, emphasizes the role of the autonomic nervous system in shaping emotional and social behavior. By integrating polyvagal-informed interventions, such as regulating breath and enhancing social engagement, therapists can address the physiological underpinnings of psychological distress, adding a valuable dimension to traditional therapeutic modalities. The interdisciplinary nature of integrative therapy also invites collaboration with adjacent fields, such as neuroscience, medicine, and social work. For instance, insights from neuroscience can inform the timing and sequencing of different modalities, optimizing their effectiveness based on the client's neurobiological state. Similarly, collaborations with medical professionals can enhance the comprehensive care of clients with co-occurring physical and mental health issues, ensuring that interventions are aligned across disciplines. As the field of integrative therapy continues to evolve, it is imperative for practitioners to maintain scholarly rigor and precision in their work. This involves staying informed about the latest research developments, critically evaluating the evidence for various modalities, and engaging in continuous professional development. By doing so, therapists can ensure that their integrative practices are grounded in empirical evidence and best practices, ultimately enhancing the therapeutic partnership and fostering transformative outcomes for their clients. In conclusion, the integration of multiple modalities represents a sophisticated, dynamic approach to therapy that aligns with the principles of partnership and collaboration. By drawing on diverse theoretical and practical insights, embracing interdisciplinary perspectives, and engaging in critical synthesis, therapists can create a rich tapestry of interventions that address the complex, interconnected dimensions of human experience. This integrative approach not only enhances therapeutic efficacy, but also reflects the inherent complexity and richness of the human condition, offering a path toward deep and lasting healing.